stop talking about that. Ask them the pertinent information. How did this happen? What can't you do? When do you feel symptoms? What have you tried to do for it lately? Those types of things. Then we're on to assessment. And assessment should be, the first thing you should be doing is watching them move. Total body screen, shoes off, no braces, no tape, no garbage. Watch them move without any external support and see where they fail. Okay? So if you're not watching them move and you don't understand why they have pain or lack of range of motion or weakness or stiffness or whatever at a specific angle of what they are doing, then you can't get to a treatment. So there's the big dysfunctional gap that school left you with. You don't know how to assess function. When you do assess the function, you don't know how to analytically whittle that down to, here's what the problem is. Is this an eccentric contraction, concentric contraction? Is this lack of pronation? Is this lack of pronation control? Is this, you don't understand how to do that stuff. So then you can't come up with a treatment that's worth a crap. All right. So once you get their little subjective, once you go through a full total body screen, watching them function, where they fail, and understanding why they fail when they fail, and getting that done in less than a minute. So we're not doing the SFM, FSA, whatever screen for 45 minutes to an hour, because all that does is get you to a diagnosis. And then you go do your treatment plan protocol. So I have no idea why anybody would do the SFMA, SFFMS, whatever the hell it's called. I went to that course for 2 days and it was the biggest waste of time of all time, because all they do is dump you back into the dysfunctional model. You don't learn anything about why that person is failing that screen. So you have to be able to understand how different people move, because nobody's going to be the same. If you have 10 people come in with plantar fasciitis or patellofemoral syndrome or idiopathic low back pain, all 10 of them are going to have a different presentation once you get down to the root cause. They're going to have similarities, but they're all going to be different. So that's why if you just throw them into a protocol, 10% will do well with the protocol. They won't do phenomenal. They'll still have to come in twice a week for 6 to 8 weeks or whatever, but at least they'll progress slowly. The other 90% won't progress at all because the protocol totally missed what the problem is.